Hi, my name's Kyra Wong. I've been an Egoscue posture therapist and yoga teacher for over 20 years. And at this time, when you can't see your manual therapist and your massage therapist or chiropractor or even your physical therapist perhaps, I thought it would be helpful to put some sets of exercises together that might help you continue to work on your body. I put this set of exercises together for anybody who has something going on in their pelvis, whether it's elevated on one side or tipped forward or backwards, something different between the right and left side. And this menu is specifically for people who might have pain when they're sitting but feel better with movement. So you're going to grab a block and place it between your legs. You could also use a ball or something that you can squeeze, a roll of paper towels or even a roll of toilet paper if you have some extra. Squeeze in on that block and then take your fingers and bring your fingers to your palms, but keep your palms open. Arms out to the side, take a deep breath and make space in your spine so that you're actually hugging your waistline more narrow. And then bring your arms out to the sides, squeeze in with your knees, and a little bit with your glutes as well. Hold about a 50% engagement with your inner thighs, your glutes, and your belly. And then lengthen your collarbones so that they get wider apart, and then circle forward about a 6-inch circle 40 times. 40 times forwards, and then turn your palms so that they're facing up. Squeeze in, glutes activated, belly activated, collarbones get wide, big breath. Floating your rib cage up and circle backwards, 40 circles back. That's going to help align the whole lumbar spine into the pelvis, into the legs, and make more balance and symmetry between the right and left sides of your whole body. The next exercise is a static ankle squeeze. So grab your block, place it between your ankles, coming down onto your hands and knees. Allow your belly to hang toward the floor, your knees to be just behind your hips. Then let your shoulders squeeze all the way together and then press back out of it just a little bit so that you're engaging the muscles along the side of your body. Then tuck your chin, let your head hang down, and squeeze the block at your ankles 20 times, hugging in, feel the muscles of the inner thighs work. You also have muscles on the outer thighs that will have to adjust to this position. Squeeze and release. After 20, come on out of this, reset your position, and then go back into that, honoring the gentle rounding of your upper back, the arch in your lower back, and again, allowing your head to drop. Squeeze and release for 20 more. Coming out of it one more time, and back in. Next, you're going to need to have some kind of dowel, a stick or the end of a broomstick or mop, something like that would work fine. Come down onto your back. Place one leg over the dowel and one leg underneath. And then you're going to push one leg so that you feel the butt and the hamstring activate, and then pull with this front leg so that the front hip flexor is activating. Push, pull, and then release. Push, pull, release. Do about 20 of those and then switch to the other side. Again, one side using the back side of your leg, the front side of the opposite leg, pushing and pulling will help bring balance to the two sides of your pelvis. And release out of that. Then grab your block once more. Place it between your knees. Put a nice curve in your low back. Do a little bit of a crunch and walk your whole rib cage up so that your spine gets long on the floor, and then make sure there's a curve in your neck. Tuck each shoulder blade underneath you and then squeeze and release the block at your knees. Squeeze and release. 3 sets of 20 as well. That whole menu should add balance and symmetry to the two sides of your pelvis and potentially take out any tweaks that you might be feeling in the low back or hips. Thanks so much. Again, this is Kyra Wong. Stay connected to our YouTube channel or find me at the website painfreestudio.com.